lot of you have asked about thrush. So let's talk about what thrush is and how to treat it. The mouth is a very moist area, and because milk can stay in the mouth, it's very common for babies to get something called thrush. And what that is it's an overgrowth of yeast in the mouth, and you get a white layer on the inside of the lips and also on the sides of the cheek. You can see it on your tongue as well. And usually if it's just leftover milk, you can very gently scrape it off. But if it's not coming off, and especially if your baby seems uncomfortable and they don't want to bottle feed or nurse, you really should have your doctor check it, because then it's most likely thrush. The way to treat thrush is generally by treating with an antifungal, and the most common one that's used is nystatin. And that comes in a suspension, and if your doctor sees that there's thrush, that's what they'll prescribe. And what I found is a lot of parents get very confused on how to use it. But basically the bottom line is you want the medicine to be the last thing in the baby's mouth, not formula. So what you want to do is you want to give it after they've eaten. And the doctor may prescribe a particular amount, but generally what you want to do, based on what your doctor advises, is you want to squirt a little nystatin on each side of the cheek and then smush your baby's cheeks all around, get it under the lip and on bottom lip, and that's going to sit there until the baby's next feeding. So the doctor may tell you to do it after every feeding. They may say 4 times a day, but regardless, whatever your doctor tells you, you want to make sure that you don't eat right after, because you want the medicine to be what's against the gums and the areas that have thrush. It can take a very long time to clear up thrush, sometimes even up to 4 months. So you want to be very diligent in doing it. You want to make sure that you don't contaminate whatever dropper you're using, because then you get thrush on the dropper and that goes into the medicine. So sometimes the easiest way to do it is to take 2 Q-tips, put those into the bottle, and then use that to get it in the mouth and smush it around. The other hint that I didn't mention earlier about thrush is if you are nursing and you develop very sore nipples and your baby is fussy with feedings, it could be that you have some yeast on your nipples and the baby is getting thrush. So you certainly want to bring that up to your doctor so you can both be treated.